We are the Pelvic Health Physiotherapy team here in Somerset. This video will explain how to do pelvic floor exercises. It may help to watch the video titled Pelvis and Pelvic Floor Anatomy and to have a vaginal examination by a pelvic health physiotherapist before watching this video and starting your exercise program. Try doing a basic pelvic floor squeeze now. You might find it easier to sit or lie down. To do a pelvic floor squeeze, start by tightening around your back passage as if you were stopping yourself passing wind. At the same time, pull forwards and up as if to stop the flow of urine. This should create a squeezing and lifting sensation in your vagina. You may also be aware of a gentle tightness in your lower tummy. Then, to stop squeezing, completely relax your tummy, let go of the tension around your urethra and back passage, and allow the muscle to fully relax. The pelvic floor and lungs have a special working relationship, and you can use this to your advantage when you're doing your pelvic floor exercises. As you can see on this video, when you breathe in, the pelvic floor automatically relaxes a little. When you breathe out, it tightens and lifts slightly. This is a reflex we are all born with. So when you do a pelvic floor squeeze, try to time it with an out breath. Don't worry about changing the rate, depth or force of your breathing. This may feel a little tricky at first and can require practice, but it is worth it. We know that squeezes done while breathing out tend to be a lot stronger and more effective at closing up the anal and urethral openings. Once you feel you have mastered this squeeze and can time it with your breathing, you can start a basic pelvic floor exercise program. Firstly, we need to work on your stamina. This means squeezing and trying to hold that squeeze for as long as you can, aiming for a maximum of 10 seconds. It is fine to start with just a few seconds and gradually build it up as the days and weeks go by. As I said before, try and start the squeeze as you breathe out. One easy way is to count the seconds out loud. When you come to the end of the 10 seconds, or maybe earlier if you need to, then fully relax. Sometimes it can take a while to fully relax, so give yourself at least 5 seconds to do this. Then try to repeat this long squeeze several times in a row. We always aim for 10 repetitions, but you can start with less and build up. The second part of the exercise is to do some quick squeezes. This means squeezing and lifting your pelvic floor as strongly as you can as you breathe out, and then fully relaxing the muscle straight away as you breathe back in. Aim for 10 of these in a row. Do this whole plan 3 times a day, every day until you are non-symptomatic, then once a day, every day for the rest of your life. Your pelvic floor exercises can be done in a variety of positions. You will probably find it easier to start in lying or sitting, but as your muscles improve, aim to do the exercises in standing. Perhaps the hardest thing about pelvic floor exercises is remembering to do them 3 times a day. Have a think about how you will plan these exercises into your day. There is an NHS app called Squeezy that can send you reminders and talk you through the exercises. You need to do pelvic floor exercises consistently for 3 to 6 months to see any improvement in your symptoms, so please don't give up. In order to check whether you're doing this pelvic floor muscle squeeze correctly, you may benefit from having a vaginal examination by a pelvic health physiotherapist. They can teach you a pelvic floor exercise program that is suited to your individual needs. Thank you for watching this information video about pelvic floor exercises. If you have any difficulty following the advice in this video, or if you have any questions, please contact your pelvic health physiotherapist. Please also watch our Red Flags in Pelvic Health video to check any symptoms that need reporting to your GP.